I'm Dr. Christopher C, and welcome to this audio summary. No diagrams, no explanations, just me reading anatomy to you. In this video, we'll cover the muscles of the posterior abdominal wall, including their origins, their insertion, their function, the nerve supply, and the blood supply. The 5 muscles that comprise the posterior abdominal wall are the diaphragm, Posas Major, Posas Minor, Iliacus, and Quadratus Lumborum. The first muscle is the diaphragm, which originates from the xiphoid process, the lower 6 costal cartilages, and L1 to L3 vertebrae. It converges into its own central tendon. Its action is to draw down the central tendon of the diaphragm during inspiration, thereby enlarging the thoracic cavity. Its nerve supply is from the phrenic nerve, with nerve roots C3, 4, and 5. Its arterial supply is from the pericardiophrenik, musculophrenic, and superior phrenic arteries from above, and the inferior phrenic artery from below. The second muscle is Posas Major, which originates from the transverse processes, vertebral bodies, and intervertebral discs of vertebra T12 to L5. It inserts onto the lesser trochanter of the femur. Its action, together with Iliacus, is flexion of the hip. It also flexes the trunk, and acting unilaterally can flex the vertebral column laterally. Its nerve supply is from short local nerves from the lumbar plexus, nerve roots L1 to L3. Its arterial supply is from the lumbar branches of the iliolumbar artery, which itself comes from the internal iliac. The third muscle, which is sometimes absent in patients, is Posas Minor. When present, it arises from the vertebra of T12 and L1, both the vertebral bodies and the corresponding intervertebral disc. It inserts into the pectineal line, which is a ridge on the pubic bone, as well as the iliopectineal eminence, which is a groove on the iliac bone. It acts as a weak flexor of the vertebral column. The nerve supply is again short local nerves from the lumbar plexus, nerve root L1. The arterial supply is a lumbar branch of the iliolumbar artery. The fourth muscle is Iliacus. It arises from the superior part of the iliac fossa, the ala of the sacrum, and the anterior sacroiliac ligaments. It inserts into the lesser trochanter of the femur, as well as the tendon of Posas Major. Its action is to flex the hip and stabilize the hip joint, acting together with Posas Major. The nerve supply is from the femoral nerve, with nerve roots L2, L3, and L4. The arterial supply is from the iliac branches of the iliolumbar artery. The fifth and final muscle is Quadratus Lumborum, arising from the inferior border of the 12th ribs and the transverse processes of lumbar vertebra L1 to L5. This inserts into the iliolumbar ligament, which is a strong ligament running from L5 to the iliac crest, as well as the iliac crest itself. Its action is to extend and laterally flex the vertebral column, and it also fixes the 12th rib during inspiration. The nerve supply is from the ventral rami of T12 and the first 4 lumbar nerves, L1 to L4. The arterial supply is from the lumbar branch of the iliolumbar artery. That's all. Thank you, and see you next time.